You're listening to Switch On, a podcast to shape the principles of modern leadership. We will be discussing the real experience with successful leaders and learn from them how are they tackling real-life, real-time challenges and build on their learnings for tomorrow's success. In this series, we'll focus on how we are bringing vision to life. Having a purpose, a vision alone, is not enough to be successful. Both require action. Without action, vision is nothing more than a dream. The key to success is to stay focused and be realistic about the current situation, and then learn perfect along the way. But as soon as we identify it, we need to start living it. Rome wasn't built in a day, as the saying goes. So many people give in and fall short of success. Balance and consistency are key. So make a plan and stick to it. Don't burn yourself out in the first couple of days and then give up when things you want don't just fall into your lap. Make a commitment to show up. Put out great content and build connections and relationships with people who can help you reach your goal. In this situation, I think it's only right to take a look outside of private commercial enterprise environment, to look broader into community that has so strongly impacted all of us and shaped our day-to-day in recent months. Pandemic has turned our world upside down in an instant, and we are still recovering. So in this context, we need to look around for new experiences and gather different perspectives, different viewpoints. So I'm privileged to have an expert guest with me today, Dr. Mateja Logar. Dr. Logar is an assistant professor, Doctor of Medicine, Infectious Disease Specialist at the Department of Infectious Diseases and Department for Hospital Hygiene at University Medical Center Ljubljana. On top, this year she has taken the role as head of the advisory group for COVID-19 Containment and Epidemic Management at the Ministry of Health. In this role, she's influencing the reduction of the virus spread and thus contributes to maintaining a healthy environment in the institutions of University Medical Center Ljubljana, as well as elsewhere. Welcome, Dr. Logar.
Thank you for your invitation.
Great to have you with us. We are not here to talk about COVID. We can all agree it's getting enough promotion as it is. We are not here to talk about politics either. We are here to discuss and learn from your experience. How are you managing the challenges you are faced with when trying to mobilize people? What works? What doesn't? What are your learnings out of it that can help others? Dr. Logar, I can't avoid asking, how come you have decided to take this step during the pandemic? I'm sure it was not an easy decision to step into such a demanding role. What was and is still driving you?
Yeah, it is an interesting question. It was never in my path to think about such a role, but at the end of February, Minister of Health called me and it was not a question, it was a statement that he has seen me in the position of the head of the group for the COVID. And it was not really something to give a lot of consideration, because I know that my point of view about COVID was made early in the epidemic, and that my knowledge about COVID was sufficient to give my part in that role. It was more a question about the other influences, about the communication with media, communication with politics. So that was more concerning for me, but I have decided that I have to try also this role, and that was the decision that I have made, and now I'm trying to stick with it.
A courageous approach, thank you. You are tasked with mobilizing people and the entire community. How do you balance between different roles where one has a clear priority?
My primary role still is to work as an infectious disease specialist. So I work still the regular hours at the Department of Infectious Diseases, mostly nowadays as a consultant, because it is hard to balance with the hours on the regular ward. You have to be present on the ward when you work with the patient. So because of other meetings, I don't really feel that it is right for the patients and for my colleagues to be just partly present at the ward. So I'm working, as I said, as a consultant. That means that I go to different wards in the University Medical Center and advise about antibiotic therapy, about the diagnostic and the treatment of complications according to the policy in the hospitals. That is especially about the hospital-acquired infections, but also about the infections that arrive in the community. So I try to help other specialists with dealing with the infectious diseases.
Your expertise plays a very important role. I wanted to ask, how is actually your background supporting you when you step in front of public, trying to reach understanding, when you influence and shape opinions? How it's supporting you when you're trying to reach consensus while leading the effort to contain the spread of the virus?
I think that the role of being the assistant professor at the university helps me in that field as well, because when you're teaching, you have to explain to the students things in a different way when they are explained to your colleagues. So that was already built into my knowledge, and my opinion is that you have to use the lay terms, not the very difficult words which are not very well accepted in the public, because sometimes people don't understand them. So I always try to explain things as simple as it's possible, and try to address the specific group of people I'm talking to. It is very important that you have a clear message in your head. Everything else is simple. When you know what you want to tell, what is your primary message, then you just stick to your knowledge, stick to what you want to be heard. And I think that is the most important. It is really easy to get lost in the questions. So that is why it is so important that you get your message clear first in your head before you go out and speak with the news people.
So true. We see you a lot through media, and I'm sure communicating and arguing necessary measures, it's not an easy task. And people tend to look for scapegoats and someone to blame. Yet your communication style is very open. You come across as authentic, arguing decisions based on facts. You remain very consistent and determined in your resolve. How do you prepare for such a statement? What do you think about before you step in front of media, in front of cameras?
First of all, I want to keep my knowledge up to date. So I try to be informed about the new data which was published recently, and to dilemma in medical community. And after I'm sure that I know quite a lot about the topic, then I'm also ready to speak about that topic with the journalists. And usually the journalists tell me what are their primary questions, so I have a little bit of time to think about things I want to communicate with the population. And usually also the journalists are very supportive, so I think I have a very good relationship also with the journalists. So we are trying to be on the same side and work together.
That's very important, and a little bit of the heads up always helps. I like the way how you say what you mean to say and explain the situation in layman terms, like you have mentioned, so that everybody can really understand you. But we have also noticed your t-shirts and their messages. With those, you are actually making a statement. How come you have decided to leverage your visual identity to support your message?
First, I got some t-shirts about the transfusion, and they were really nice t-shirts with nice messages. And then I have decided to find some more t-shirts with some medical terms and some terms which are not so medical but are appropriate for the situation. And it was sort of some relief from the severity of the situation, and it was like an escape, and to put me in a different perspective, not just someone who is always talking about bad things, what is going to happen, which things will not be permitted, and I think that seeing me also as a private person also helps to get closer to the people.
Yeah, I fully agree. It's a very unique approach. And in some of these messages, you really let us know you are human as well, a mother, that you are no different from the rest of us. Do you think this might be the reason the media is reaching out to you in a less judgmental manner, that this is a base how you also establish certain relationship with them, wanting them actually to learn more about you as well?
That is for sure one of the reasons, and the other is that I really gave a lot of my time for their needs. So I was really approachable also in my free time, also during the weekends. So I think at the beginning of our communication, our relationship, they were sure that they can count on me. And I think that is one of the important things, not just in the communication with media, but also in the other structures of life. So when someone knows that he or she can trust you, that he or she can count on you whenever it is needed, then you have a different relationship, and it is easier to work on it.
An important notion. So it's about the commitment and being there for the people. If I may ask, what about your family? How are they taking all this in with your busy schedule, media exposure? In the end, your presence, your leadership is affecting all the family members.
Yeah, fortunately, they are doing quite well. They understand, they are supporting me. There is no judgment that they're exposed or they have some problems because of me. Sometimes children cannot understand when there is some hate speech on the street that is still disturbing for them. But otherwise, the schedule is something that we work on. We discuss how we will manage during the week, and we try to have some free days just for the family to go somewhere to be disconnected from the other world. So it is achievable.
Yeah, but so important also to unplug in the meantime, because you can only battle one front, right?
Yeah, sometimes you have to prioritize things. So sometimes some things are more important than the others. And it is for sure that some things and some tasks can always wait. It is never that everything must be done in the same moment.
So true. In your role, you advise the government what are the best actions to take, considering all data, expert views, developments in between, infrastructure capabilities and trends. On the other hand, the final decision on what measures will be taken is not yours. What tactics and principles are you using to influence the final decisions that will go out and people will need to follow? And how do you convince the decision makers which strategy is needed, and this way ensure that the expert view is followed?
It is not as difficult as it might seem from apart. Also, our decision makers are listening to our decisions when we present them with the data. So the scientific data are the most important. So if you explain to the politics why something is important and what are the basics for that and what can be the consequences if we would not approach this problem as we want to, then a lot of things can be discussed and come to an agreement. It is for sure that we have sometimes a perspective from the medical point of view and don't get enough data, or we don't have enough knowledge about education, the sociology, the economics, and because of that, you have to listen to other experts in that field and come to a common agreement. It is not the epidemics that is solely the problem of the health, it is the problem of the whole community. But because of the situation in Slovenia, a lot of things were done because of the limitations in the healthcare system. But nowadays we can give some more space also to other fields and take into account other needs.
When you're providing the advice, how do you decide between what really should be a necessary measure to follow versus what is realistic or rational to expect from people? How do you approach this fine line with your suggestion to maximize the impact?
You have to keep in mind that what you do or suggest today might seem very nice and very good, but if you look back from a distance, like from 1 year or 6 months, then you see that the decision was not as good as it seemed at that time. But at the certain time, you have the certain knowledge, you have certain data, and you do what you can do the best in that moment. And then you try to wait a certain amount of time, because when you're changing things too quickly, then people are not very comfortable. And the humans are really not as adaptable as we like to think. We like certain things that are the same as we are used to, that we have a certain certainty. So it's better to give some time for people to adjust, and then reevaluate and try to adjust smaller things which will be better accepted in the community. But it is difficult to import some things from other cultures, because the sociological point of view is also very important in the way people are accepting or excluding certain suggestions or certain advices. So something that is very acceptable in the Western or Northern cultures is not acceptable, and it's not something that is really good for the Southern countries. So you have to balance and choose the right actions for the right time.
Some measures have an impact, some don't, as you say, and perspective always helps. What I think is important is to learn from our experience and take what was actually working going forward. But things can also go wrong and take a turn unexpectedly. What is your take on the responsibility when final decisions are not yours? How do you feel about that?
I came to the term with this at the very beginning. Our group is here to support the Minister of Health, to give him directions in which to communicate with the government. And we try to support him with the scientific data as best as we can. And everything beyond that is not in our or in my capabilities, so it's not something that I can influence. So it is not for me to decide what government do. I can just explain to them why something is important, what is the scientific base for this, and I can as well say that we as a group were not suggesting that to government, and that was the decision of the government. So that is something for them to consider.
Mm-hmm. You're raising a very valid point. With responsibility, there also comes transparency. And as an expert authority, many people see you as a protector of public health, a protector of people, also in instances when decisions go against expert rules, or if those decisions are misleading or even harmful simply to trick the people into action. How do you address this kind of situation? And what is your empowerment where you see things executed in the wrong direction?
As I have said before, I'm primarily a physician, and everything else is just something additional for this time being. And I always think about the patients first. So I try to build the ideas about the measurements based on what and how will this affect the patients coming to the hospital, patients coming to their general practitioners, and also our group try to keep the health system accessible to all the people. So it is not just the COVID. There are also the other patients, other people who need our health system, and they need it as much as the patients with the COVID. So that is something that we have to keep in mind, and that is also important that we share that information and that knowledge with our community, that they will understand that we are not just protecting people with COVID and try to help just the people with who got COVID, but we try with those measurements that also all people who need healthcare, they can get access to the healthcare system, and they will get the diagnostic procedures and the therapy at the right time.
So important. Often these days, what you have just mentioned is forgotten. It looks like there's only COVID. But as you mentioned, first and foremost, you're a doctor. And the other day, you have mentioned a challenge. You talked about staying up to date with data, expertise, trends, to be appraised about all the relevant development as a base for your proposals. And this happens every single week as the pandemic continues. How do you manage to follow up on all the expert insights while juggling the other roles?
I'm sure I don't read everything that came out, but I try to read the most important data. It was very challenging, especially in the March last year when there were the first patients already in our country, but we didn't have any relevant information from Europe. So we were just waiting for some data to come out. There were mostly the data from China, then also from the Italy. There were no guidelines. There were no real publication. It was just the preprint. So without the editorial checking if the data is really relevant, is it really well written? So a lot of papers were out without any real checking if everything is according to the standards. And there were also a lot of papers which were retaken, so it was rewritten, or some were also taken away, so it was shown that the data was not correctly collected, or there was some fraud also in the papers. But sometimes when there were just the written, printed publication, it was easier when something like that happens. But nowadays, when there something come on the social media or somewhere else on the internet, it stays there forever, even if the news is not correct. So it was really a lot of fake news from the beginning of the epidemics, and a lot of damage was done in that field. Even for the experts, it was sometimes very difficult to know which data is good, which data is ready to use, and when you have to wait for a couple of more weeks to get really relevant data and not just the pre-study information.
Mm-hmm. You're so right. I mean, internet, social and traditional media, all are flooded with information, expert and personal opinions, conspiracy theories. Where have we gone wrong? What is your view on that?
Internet has brought a lot of good things, but also a lot of bad things, so to say. It is much more difficult to have a good perspective if you don't have enough knowledge. So something can seem very, very honest and very scientific, but the interest can be very, very wrong. So there are some so-called scientific papers which are not scientific. They are publishing for quite a lot of money things which would be rejected in the scientific papers because the data is not collected correctly. But for the right amount of money, you can publish in that kind of papers, and they are usually easily accessible online without a fee. So that is the problem, that a lot of lay people get the information from that kind of papers, not from the really scientific journals which are doing their job as it should be done. So they do the revision and also the recension and send back to rewrite the papers. And before the paper is published, it is really going through multiple times with different perspectives that you get the good and relevant data.
Many people agree that this crisis should be led by experts and that an educational approach should be used to gain higher participation, consensus, and understanding. Locally, we are experiencing a stick and carrot approach where reward and punishment don't seem to work, where people are frustrated and losing trust. Would educating people, empowering them to make informed decisions be a better approach, a more impactful way to gain people's understanding, commitment, and trust?
Yeah, we have two different approaches. It is the empowering people is going very well in the Western and the Northern countries. We have tried with that approach already last fall, when we have tried to persuade people just to listen to the advices, not to have the law about something. But unfortunately, in our situation, that was not working as well as in the Scandinavian countries. We have also given the opportunity to the general population to decide for the vaccination from May this year. We have tried with the free approach to the vaccine centers. We have tried to approach people in different ways, so to take care for their own good, to try to persuade them that they are responsible for their health, for not getting sick. But as you have noticed, that approach didn't work as good as we wanted to, as it worked in the Scandinavian countries. The other approach is more common in the Eastern cultures, like in the China, also in Japan and Korea or Vietnam. They just give out orders, put military on streets, and dictate what people can or cannot do. That is the approach which is really not suitable for our country. So we are somewhere in between. We have to give some firm rules with the right space for people that still have the feeling that they are also taken into the account, that they count with their opinion, and they're able to participate with their way into the community.
You're saying we're somewhere in between, and that might be right. I don't want to go in the other more Eastern direction. I think nobody would actually like that. And I think we can all agree, we have all expected the pandemic would be over more quickly, yet we continue to experience wave after wave, one strain more infectious than the other. And we still don't know what is coming next. How are you managing this uncertainty and finding the patience and optimism going forward with so many moving parts?
Yeah, we all thought that it will be over a bit sooner than it will be. So we were hoping that the vaccination will bring the end of the epidemics, but because of the low number in Slovenia, we are still quite in the depth of the epidemics. But you know, when you are in the middle of the sea and you are try to swim as long as you can and hope that you will reach the shores of that island. So it is the same in our situation. We have to keep going. There are people out who are counting on us that we will make the good decisions for them and for the community. So that is our goal, that we will bring the epidemics to the end, that we will help as much people as we can, And that is our goal, that we will try and help those who need our help.
In the end, we will need to learn how to live with it, right?
Yeah, COVID or SARS-CoV-2 will stay with us in a certain way. We don't know in which way. It will probably be one of the respiratory seasonal viruses which are present all over the year. Probably it will stick to the fall and the early winter. Probably in the next couple of years, the vaccination will be needed against COVID-19, but I think no one really knows in which way the virus will adapt in different countries. But for sure, epidemics will come to the end. All the epidemics in the history came to the end, and also the COVID-19 will come to the end.
There's a saying, if you don't go, you don't have a story. From every experience, we gain something, we learn something. Looking back, if you would be given another opportunity, would you make the same decisions or would you change something?
For sure, I would change something because I would have a different knowledge than I had when I started with all this. But it is the opportunity which I am very thankful that I have it. I have met a lot of people I wouldn't met in other circumstances. I have learned a lot about myself, about community, about people. So that is something that will stay with me forever.
It's really good to hear you say that. We tend not to celebrate the moments when we do enjoy what we are doing. And I think we should do more of that as well. When mobilizing people, getting their buy-in, their engagement in a difficult situation like this, what should we keep on top of our attention list when we are influencing for the good? When we need to turn things around in a couple of days to mobilize people and be successful at that?
We have to keep in mind to be honest. To be honest, why we do things at the certain period of time, and we have to also tell people that we don't know everything, that things might change over the next couple of weeks or next couple of months. And we have to try to explain them that the changes are unpleasant, but that they're needed. And I hope that people will understand that, but it's easier at the beginning of such a situation. It is the same as with the pain. When you know how long the pain will last, you can suffer quite a severe pain. But when the pain is ongoing, when the pain is chronic, then it's much more difficult to sustain that pain. And the same is also true with all the measures which are needed in the epidemics. So I think that people would accept all the regulations and all the limitations much better if we would be able to tell them this or that will be needed for another 6 weeks. And because it's going indefinitely, then it's sometimes difficult to understand why and for how long.
What a powerful conclusion. With everything going on and direction where the world is actually going, the next crisis might be just around the corner. With limited resources, growing population and climate change, this pandemic could be perceived as a small test, based on which we can learn a lot for what is yet to come. And then we'll need amazing leadership, able to engage and empower people for the better world development through participation. Dr. Logar, thank you so much for this opportunity. It has been a privilege to meet you and being able to have this conversation on top of your priorities with you. Thank you so much for being with us and sharing your experience.
Thank you for the invitation and for the nice talk.
Great to have you with us.
This podcast is brought to you by Drop of Milk, an impact-driven business consultancy and expert on customer-focused digital transformation. You can learn more at dropofmilk.com.